Hello, my name's Adrian Richards. I'm a plastic and cosmetic surgeon, the surgical director of Aurora Clinics based here in the United Kingdom. Today in this is the last of our breast reduction videos. I'm going to be talking about things that can go wrong following breast reduction surgery and the things to look out for. So essentially, breast reduction surgery is like any other form of surgery. Nowadays it's relatively safe. The blood loss is much reduced. Anesthetic techniques have improved a lot. I perform 100 of these procedures a year, without major problem, touch wood, for the last 5 years. However, the human body is unpredictable and things occasionally go wrong. Okay, so what can go wrong? Well, things can go wrong related to the anesthetic. Okay, so if you're in good health, you haven't got any heart or lung problems, you're very unlikely to have a problem with the anesthetic with an experienced anaesthetist, so we can probably sort of rule that one out. Okay. One of the things to look out for though with any anaesthetic is a blood clot, and this is called a DVT, so that's a deep vein thrombosis, and that's basically because you're asleep on the operating table, you can get a clot in your calf muscles, and that's a deep vein thrombosis. Now if that clot becomes dislodged, it can move around your body into your lungs. And if it causes a problem in your lungs, you can have problems breathing, and very big clots can be very, very serious. Okay? So you must let us know if you get any pain in your calf, okay, or any pain and difficulty breathing following the surgery. We take every precaution to minimise the risk of DVTs. You'll have what's called calf stimulators on your calves, which basically massage the calf through the night, keep the blood flowing in the day following surgery. And this will continue, and we get you up early the next day to keep your legs moving, and it's very rare you're going to get anything if we keep your legs sort of moving. It's generally people that lie in bed for a long period of time that get DVTs, but if you're worried, again, let us know, we can investigate it and it can be treated. Okay, so the other things that can really cause problems are things that are related to the breast tissue. Okay, so it's very, very unusual to get problems with the blood supply to the nipple, but it can occur, particularly in people with very big busts and people with very big reductions and smokers, and normally sort of slightly older people have a less good supply to the nipple. So in my experience it occurs, I've never had a complete loss of the nipple, but some people get slightly delayed healing, and it probably happens in sort of 1 in 20 people. It's not a disaster, it just needs dressing, and it will heal in time, normally a month or so. The other problem, you can sometimes get poor healing, is on the junction of the T junction, that's the junction of the vertical scar and the transverse scar. That's got the worst blood supply. If there is going to be a problem with healing, that's where you sometimes get it. So again, probably 1 in 20 patients, normally more common in smokers, may get problem with healing there. And by problem, I mean that it's going to take a bit longer to heal, so we may need to dress it for a few weeks to get it healed. Not a big problem in the end. The scar might be slightly more red in that area, but it's normally not that noticeable. So delayed healing is a potential problem. The other main one is fat necrosis, which basically is a firm lump in the breast, which is caused by lack of blood supply to an area of tissue in the breast. That can occur. If that occurs, it normally occurs a couple of months after surgery, and we need to investigate it and possibly just do a little biopsy to make sure that it's fat necrosis and nothing more sinister. And the final thing is really the scarring. Scarring is unpredictable. We try and use absorbable stitches, the latest stitching technique, to reduce the risk of poor scarring, but it can occur sometimes. But it's important, if you think you may have poor scarring, if the scarring is itchy, lumpy, or getting any worse, you need to let us know immediately. Then we can get you in and we can advise you on topical things, plasters and things to put on the scars to reduce them, and there's actual treatments to reduce the scars. So it's important to try and get on top of the back. If the scars are getting a bit lumpy, it's important to get on top of them early to prevent them getting any worse, because it's easier to prevent them getting worse than to treat them when they're formed. So I hope that's been informative. If you'd like any more information about this form of surgery or any other form of plastic surgery, we've got a number of surgeons at Aurora Clinics who specialise in different things, from rhinoplasties to body lifts to ears, noses, all different surgeons with different specialities. So please feel free to contact us, and we'll arrange a consultation with a suitable specialist. Thank you.